I also caught a cold this weekend, so pardon my my topic is the Obama healthcare plan, and my main claim is that the Obama healthcare plan is inefficient. And many of you have probably heard about like all the healthcare, like how so many people are out of healthcare, and I don't deny that it needs to be reformed, but I think Obama's solution has a lot of holes, like really big holes in it. And the three main ones are we currently have insufficient funds and resources to completely revamp or to introduce universal health care to America. Universal health care would lower the quality of health care in America, and it would create and the third one is universal health care would create a lot of like waiting time. It'd be really hard to get procedures that were needed at the time. Back to my first claim was that we have insufficient funds. Universal health care is not like a small project, it's like a huge ordeal. And according to the U.S. Census Bureau, nearly 47 million Americans, or 20% of the population under the age of 65, were without health care in 2008. And then a New York Times writer, David Leinhart, wrote that health care will cost typically a household roughly $15,000 a year. What this means is, like, say the average family is about 4 people, and you times that by the amount it would cover, or the amount, the 15,000, which is how much it would take to insure a family, and that's about $176 billion, and that's not even including the people who would switch from their own personal plan to the universal health care plan. And then that adds up to a lot of money, and as you guys probably know, we're already in a budget deficit of like a couple $1 trillion. On to my second claim, it would lower the quality of health care, and Dr. John S. O'Shea says in My Family magazine that compared to the private sector, government programs are inefficient, and the higher costs have to be paid for with higher taxes or spending cuts in medical research and development. The cuts that would be made would harm the medical field like significantly. It would result in a lot less money going to research to like develop better medicines, and without this research money, there'd be like doctors would be paid less, and with that'd be less incentive for doctors to become doctors, and there'd be fewer doctors, which leads me to my third point. Waiting for services would increase a lot, and Canada is a good model for this. They are currently using universal health care, which we've been known to model a lot, like in our Obama's future plan. Although it seems fine, like it has a lot of internal problems. David Grabzer, a Canadian doctor and citizen, wrote about a particular time when he was at medical school in the City Journal about, he said that one day going to class, he wrote, the ER was overflowed with elderly people on stretchers waiting for admission. And he goes on to say that patients had to wait for particularly any diagnostic test or procedure. This means that like even the simplest thing is like a flu shot would take up to like maybe 5 days to get, and big things like cancer treatment, like some people it would take maybe years to get. Like there's been reports of people coming down from Canada to get U.S. treatment because they can't get it in Canada, and that's what we're trying to base our universal health care off Canada. And so, in conclusion, the Obama's healthcare plan is we don't have enough funds or resources. It would lower healthcare quality, and receiving healthcare would be almost impossible.
All right, well, you laid out the main claim pretty clearly, and you outlined and previewed what the structure is going to be, and good signposting when you got to those individual points. I think the first point on costs, you start off pretty well. You've got an explanation of what the numbers mean. I think you could do some additional research because there's a lot of information talking about what the ultimate cost would be of any kind of coverage, much less a universal plan. And how expensive that would be, and then put it a little bit more into the economic conditions that we're in. What are the long-term ramifications for something with this increased cost? I think you need to develop that argument a little bit more. On the second point, there's just a whole bunch of assertions, and you need some illustrations and some data to back that up. I didn't think that it was nearly as convincing as it sounded like it was going to be. You had one good quote that you started with, and then after that it was a series of additional assertions. On the third point, you've got an example that you start with, but that's the only evidence that you have on that particular point. So the speech is well organized. We know what the main objections are, but the development of proof on those particular points I think is a little bit underwhelming. All right, thank you.